Hi, my name is Riley. I'm going to be your nurse today. I'm going to be performing a cardiac and respiratory assessment on you. Can you tell me your full name and date of birth?
Simon Glenn Smith, born August 7th, 2002.
I'm going to check your wristband and it's correct. Do you have any allergies?
No.
Any culture or religious preferences you'd like me to know about?
No.
Okay, how are you feeling today?
Awesome.
In any pain?
No.
Okay. And before I entered the room, I performed hand hygiene and closed the curtain for privacy. Client's skin tone appears even and appropriate for ethnicity. His respiratory effort is normal. He does not appear in any distress. His behavior is appropriate. His mood and affect is positive, and his body movements are smooth and no involuntary movements are noted. And his body posture is erect. He has good hygiene, appears well groomed, and there's no mobility aids noted, and there's no odor noted, and he's also dressed appropriate for the season. So I'm going to move on to your respiratory assessment. Do you have any cough or shortness of breath?
No.
Any trouble breathing?
No.
Okay. Can you take off your shirt? Alright, I'm going to inspect the chest. There's no lesions or masses noted. His respiratory rate appears normal. The depth is normal. His chest configuration, no barrel chest is noted. His chest expansion is symmetrical. Now I'm going to palpate anterior and posteriorly. Lean forward.
Hands are cold.
No masses or lesions are noted, and the ribs appear to all be in the correct place. And now I'm going to listen to your lung sounds. You take a deep breath. No adventitious sounds are heard. And now I'm going to move on to your cardiac assessment. Have you noticed any heart palpitations?
No.
Any history of heart disease or heart disorder?
No.
Okay. So now I'm going to inspect and palpate your carotid arteries. They are +2 and even bilaterally. And now I'm going to listen to them with the bell of my stethoscope for any bruits. No bruits are noted. And now I'm going to palpate his legs and feet for any edema. No edema is present. And now I'm gonna feel all your pulses. Can I start with your brachial? Your +2 and even bilaterally. Now your radial. +2 even bilaterally. And your popliteal. +2 and even bilaterally. And now your dorsalis pedis. +2 and even bilaterally. And now your foot pulse. +2 and even bilaterally. Now I'm going to listen to your heart sounds. I'm going to first go through with my bell. So mitral, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to listen here for a minute for the apical pulse.
Nice weather we've been having.
And all right.
Yeah. You watched the game Thursday?
I did. It's a tough loss.
That was a pretty tough loss.
Apical pulse is 68. And now I'm going to go through and listen with my bell. S1 and S2 are present, and then S3 and S4 and murmurs were not heard with the bell. Now I'm going to inspect the precordium, and I don't see any pulsations, and then I'm going to feel it. Pulsations are felt, and this is normal for people under the ages of 30. And then I forgot to listen to your lung sounds on your back, so I'm going to do that. No adventitious sounds are heard, and I think that completes the assessment.